Adolescents and young adults, AYAs facing cancer, represent a unique and often underserved population. Within Europe's healthcare landscape, adolescents and young adults with cancer, aged between 15 and 39 years at the time of diagnosis, experience distinct biological and psychosocial needs. However, despite their increasing recognition, many AYAs still do not have access to age-appropriate oncology services. Specialized services often remain limited to major Western and Northern European centers, large urban areas, or private settings. Why are we talking about adolescent and young adult AYA care?
We are AYA patients and survivors, so this is why this is so meaningful for us and so important.
It was a little bit weird when we started the treatment because we didn't know what it's meaning. So we started first learning about it and then started to know what are the needs of the AYA patients.
Based on literature reviews, peer visits, qualitative reports, and a Delphi process, a checklist and 8 clear and actionable recommendations were established to ensure that all adolescents and young adults living with and beyond cancer have access to age-appropriate, holistic, and equitable care. Within the European Network of Youth Cancer Survivors Project, we organized peer visits, which are a recognized tool for professional learning between organizations.
To learn more about it, besides our research, we did some visits, some peer visits in 3 countries, in 5 hospitals actually, and we learned how they implement it, how they started to implement it.
So we saw a lot of good practices and a lot of good examples that we can bring in our home countries.
What should an AYA care unit offer? Age-appropriate built environment. AYA units should create welcoming spaces designed for young people with areas to socialize, access to Wi-Fi, and the ability to personalize their rooms, supporting comfort, control, and peer connection. Clinical care organization and patient pathways. Care should be delivered by multidisciplinary teams trained in AYA-specific needs, offering access to clinical trials, mental health and sexual health services, adequate nutrition, exercise, and long-term follow-up, all coordinated through a dedicated pathway. Support services. Comprehensive support should address education, careers, housing, transport, childcare, and financial or legal needs, ensuring practical help for both patients and families during and after treatment. All services and care settings should prioritize inclusivity and accessibility. How to implement these standards and enhance cancer care for AYAs across Europe. 1. Develop a national knowledge hub for reliable AYA-related information and resources. 2. Invest in training, education, and resource optimization for healthcare professionals. 3. Integrate AYA-specific care across all cancer treatment settings. 4. Expand access to mental health services, including on-demand counseling and support groups during and after treatment. 5. Empowering AYAs through participation in care discussions and shared decision-making. 6. Enhance integration and interoperability of healthcare systems and digital health platforms to enable AYA patients and survivors. 7. Promote research and innovation in digital health technologies, age-related medical treatment, and survivorship care to further enhance the quality and effectiveness of cancer care for AYAs across Europe. 8. Advocate for policy and practice changes in healthcare systems to address AYA-related challenges and inequities in cancer care delivery across Europe.
Being part of this project, actually, it's very meaningful for me and for others to make a change, actually.